Healthcare is an ongoing issue across the country and even right here at home. Some of the most vulnerable areas in our state live in rural Oklahoma.
And vital care is becoming harder to get access to as hospitals close and federal funding is cut. News 4's Abigail Franklin joins us now with how physicians and Oklahoma lawmakers are working to boost healthcare access to rural areas.
Well, Dylan Mecca, the federal legislation is known as the Physician-Led and Rural Access to Quality Care Act. The goal? To improve health care in rural areas. If passed, it would boost care for all patients, but also bring vital resources for expecting mothers who already struggle to access much needed care.
Oklahoma lawmakers sponsoring legislation known as the Physician-Led and Rural Access to Quality Care Act, aimed at improving access to care in rural areas.
So when you put physicians in charge of that, the physician-led hospitals, which is exactly the legislation that these very wise congressmen and congresswomen are working on, that's, I think, a wonderful solution.
The new legislation is backed by Senator Langford, who voted in favor of the big, beautiful bill that cut more than $1 trillion from federal health care spending.
But when it's physician-led, north on the compass is having healthy people, right? Taking care of them and delivering wonderful babies to pregnant mothers and couples. That's something that's north on our compass.
A new report shows in the past 6 years, over 100 rural hospitals have closed across the country. Some of the most vulnerable patients suffering from the closures are pregnant women.
We've seen all sorts of data about the stress of pregnancy in general. And then on top of that, this kind of stress.
Here in Oklahoma, we have fewer than 1/3 of rural hospitals offering labor and delivery care, forcing many patients to drive long distances to give birth, which can increase risk for mothers and babies.
I mean, it's one thing if it's a beautiful 9-month process and you deliver and everything is perfect, right? But that didn't happen in my own family, right? So we have twin boys that are 25. My wife herself is an OBGYN, and at 20 weeks, she had contractions. And extremely stressful, but not difficult to find somebody close by. Now, if that same thing happens in rural Oklahoma, something that should be this beautiful 9-month experience ends up as a nightmare.
Now, the federal bill was introduced over almost a year ago and has not passed through the House or the Senate yet. Dr. McCamala says despite the back and forth of funding on funding, physicians are always finding ways to work with lawmakers to improve healthcare access in the country.